the United States right now for colon cancer screening, we generally recommend colonoscopy as the first-tier treatment. So in a patient with an average risk of colon cancer, we're generally going to recommend that you start at the age of 50. For patients that are at increased risk for colon cancer, that would be a person with a personal history of a colon polyp or colon cancer, or a family member with an advanced colon polyp or colon cancer. We're generally going to recommend that you start about 10 years before that person was diagnosed. After that, African Americans are also generally considered increased risk for colon cancer. So right now, we're generally recommending that you start at the age of 45 if you're African American.
Waiting to get your colonoscopy or being screened for colon cancer prevention is not going to make the colon cancer go away. All it's going to do is ensure that that tumor is picked up at a later, more advanced phase.
Colonoscopy is extremely important to do because it can actually prevent colon cancer before it even occurs. If you take out every polyp that you grow before it turns into cancer, theoretically, you never get colon cancer.
Colonoscopy really is the best test to screen for colon cancer and to prevent colon cancer. There are some stool-based studies, however, they're associated with a lot of false positive and false negativity. They can't remove polyps if you end up having a polyp. So ultimately, the best test to screen for and detect colon cancer is really a colonoscopy.
Now is safer than it's ever been. Staff are vaccinated, the procedure areas have been sterilized, and in many cases, the patients are screened for COVID beforehand. So you can feel comforted to know that it's low risk from a COVID standpoint.